Seterusnya, COVID-19 berikan ancaman kepada kemajuan yang dicapai Asia dan Pasifik dalam Matlamat Pembangunan Lestari SDG Pertubuhan Bangsa Bersatu. Menurut Bank Pembangunan Asia ADB, pandemik ini telah menolak 75 ke 80 juta orang dalam negara membangun Asia ke dalam kemiskinan pada 2020. Dalam masa yang sama, pandemik ini turut tingkatkan kemiskinan tegar, mereka yang hidup dengan kurang daripada $2 sehari. Menurutnya, dalam indikator utama Asia ataupun Asia dan Pasifik 2021 yang diterbitkan pada 24 Ogos, pada 2017, 203 juta atau 5.2% penduduk dalam negara Asia membangun tinggal dalam kemiskinan. Tanpa COVID, angka tersebut mungkin menurun kepada 2.6%. Untuk membincangkan berkenaan laporan ini, kita bersama salah seorang pakar ekonomi ADB yang terlibat dalam rangka Laporan Key Indicators for Asia and the Pacific 2021, Elaine Tan. Elaine juga adalah penasihat pejabat Ketua Pakar Ekonomi dan juga Ketua Pengarah di Bank Pembangunan Asia di Manila. Izinkan saya meneruskan dalam bahasa Inggeris. Elaine, thank you for joining us. Elaine, the pandemic pushed an estimated 75 to 80 million more people in developing Asia into extreme poverty as of last year, according to Key Indicators for Asia and the Pacific 2021. Tell us about the granular experiences of people in these different countries in Asia right now. Which segments of the populations are hit the most, and in what areas are they hit the most currently?
That is a very important question, and our research has shown that, unfortunately, the impact of the pandemic has been very broad, and many parts of the population experience a big drop in income. And in particular, the poorest sections of the society have had to cut back on their spending, and at the same time, while food prices were increasing. So let me elaborate more. A survey conducted by ADB Institute in 8 ASEAN countries found that 3/4 of households had a drop in income, and more than half of the households saw their income drop by at least 1/4. So many households had a diminished living standard and also a large drop in living standards. So many people were having these major negative impacts from the COVID pandemic. And this is primarily due to temporary business closures and mobility restrictions. The survey also found that poorest households, which are more likely to report a reduction in household expenditure. And this is because poorest households tend to have less cash or savings to tide them over difficult times. They also tend to have fewer assets which they can sell during difficult times. So you see a reduction of income and you see a reduction in household expenditure as well. And for many of these households, food is their biggest expense. And last year, we saw rising food prices across many parts of our region, and many economies reporting food price inflation of at least 5% last year. So in summary, the impact was broad and deep, and the poor were hit the hardest with reduced income and spending with rising food prices. So that's something to be aware of.
And Elaine, progress has also stalled in areas such as hunger. You mentioned the rising food prices, health and also education, where earlier achievements across the region had been significant, albeit uneven. Has government spending also shifted mostly to healthcare during the pandemic, of course? But what about other efforts to address issues such as hunger, education? What is happening, or what happened to that last year?
Right, that's a very good question, because as households were having drops in income as well as cuts in expenditure, government spending became more important. And government spending in our region has indeed mitigated some of the negative impact of the pandemic. And as of July 2021, ADB members had spent almost 31 trillion on relief packages. And a significant part of these packages went into health and social protection. So let me give you a couple of examples. So health spending went up by almost 0.7 percentage points in 2020 compared to the year before. And most of these expenditure went into improving health infrastructure, like expanding facilities for testing and treatment, purchasing equipment such as ventilators and personal protective equipment, as well as providing incentives to health workers, as well as assistance to patients. And another large increase in government spending was in social protection. As a proportion of GDP, government spending on social protection increased by 1 percentage point last year. And that mainly took the form of income support for like cash supplements for the poor or cash supplements for workers, as well as direct and indirect subsidies to businesses. So all these government expenditures which have gone up will have mitigated some of the negative impact on lockdown. And for education, a lot of progress has been made over the past few decades. And access to education was already challenging before the pandemic started. And with school closures and disruptions in schooling, these are more likely to affect poor students simply because they are less likely to attend schools that provide distance learning. And if they do attend schools that provide online learning, they're also less likely to participate because of their internet accessibility. So all these disruptions to schooling may have long-term consequences because schooling is important to build human capital. And poor students may also not return to education when schools reopen. And that is something that policymakers need to be alert to.
Elaine, can we just dwell a bit on that? You mentioned that the government also gave out cash handouts and subsidies to individuals and also businesses. Did that help a lot, with the expenses, with the businesses during that period? And was that a short-term measure, or did you see the effects of those cash handout and subsidies, carrying over into this year?
Well, different governments have different policies. And from our survey last year, we did see that one of the coping strategies of the poorest households was to make use of government subsidies as well as government handouts. So that was obviously an important element, important coping strategy for some of our poorest households.
Elaine, let's take a short break. When we come back, let's talk about the SDG and how the pandemic has disrupted the achieving the SDGs, SDG 2030. Let's talk about that when we come back shortly. Kita akan berehat seketika, kembali selepas ini. Bertemu kembali dan kita masih lagi membincangkan berkenaan dengan laporan Key Indicators for Asia and the Pacific bersama dengan Elaine Tan daripada ADB ataupun Asian Development Bank. Elaine, to achieve the 2030 Sustainable Development Goals, decision makers need to harness high quality and timely data as a guide for actions to ensure that the recovery leaves no one behind, especially the poor and vulnerable. That's what the report said. How can the rich data available currently help institutions and organizations address issues arising from COVID-19? And why is the usage of data still so lacking, do you think?
Yes, thank you. The ADB, as they said, has just released the KI, Key Indicators 2021 report, and that's our annual flagship publication on statistics and data in the region. And data like those in the KI report provide valuable information to policymakers in two ways. First of all, data help policymakers identify the groups of people who are most greatly affected by the pandemic. As I said earlier, it's the poor. It is for those who might have difficulty attending school during the pandemic. And so data can help governments and policymakers identify specific groups to assist during this time. And this is especially important because government resources are scarce. So it's really important to channel resources to those who need help urgently in order to ensure that government assistance is effective. So data can really help governments improve efficiency in allocation of help. And I think the second way data can help institutions and organizations and governments address issues from the pandemic is this. Because what happens now may have longer-term implications, may have longer-term consequences, we can actually see future possibilities in today's data. So data today can provide actionable insights to help governments plan for the future, either by taking mitigating action where trends have long-term negative consequences. For example, if people stay out of the workforce for too long, they may not keep their skills. So governments can take mitigating action for that. Or governments can also use data to support investments in areas that have positive long-term consequences, such as health, education, and new business creation. So those are the ways that data today can help governments plan for the future.
And Elaine, speaking of limited resources, many countries in Asia and also Southeast Asia are experiencing a resurgence of COVID-19 cases. 2021 was supposed to become the year for these countries to recover, but many analysts are expecting this year's growth to be hampered by the resurgence of these COVID-19 cases. So with coffers running dry, what reforms could these countries undertake?
Yes, in our key indicators report, we noted a number of important gaps, development gaps, which have widened in 2020. Gaps within countries, between the rich and poor, as well as gaps between countries. And all these gaps require the attention of policymakers. I would just highlight two of those gaps. The first is the gender gap. In terms of becoming employed or staying in employment, women appear to have been more adversely affected by the pandemic compared to men. Just to share some statistics, from 2019 to 2020, labor force participation rates in our region among women declined by 1.4%, while labor force participation rates among men declined by an average of 0.8%. So the impact of the pandemic on women seems to be greater, forcing them to leave the workforce and not returning. So what can governments do? Well, governments could support women who are looking for ways to come back into the workforce. They could ensure that more are able to find work in formal sectors so that they get benefits that formal sector employees obtain rather than staying in the informal sectors. And they could also help women enter jobs where they are underrepresented. And these underrepresented, where they're underrepresented, those jobs also tend to be suitable for remote work, such as professional, technical, or scientific work. And so those are the reforms that government could take in order to make sure that the gender gap doesn't widen further. Let me point out another gap, which is maybe of interest. The gap is for micro, small, and medium-sized enterprises. Now, MSMEs are the backbone of many developing economies, and they make up the vast majority of businesses. They employ most of the workforce, and they contribute significantly to GDP. And our ASEAN survey found that a significant number of households which are engaged in MSME businesses tend to be more severely affected by the pandemic. So among households with businesses as one of the main sources of income, 2/3 reported a drop in income by at least 25%, much higher than other households that do not engage in small business. So how well MSMEs fare during and after the pandemic will affect the welfare of many, many households as well. So one area the government could look into is to help these MSMEs integrate more effectively into supply chains, to help them digitalize their operations so that they can buy their inputs and sell their products on the digital platforms. This will make them more resilient to any economic shocks. So those are the kinds of gaps that the statistical report has identified, and we encourage policymakers to think through these gaps and to implement reforms.
And Elaine, access to vaccines has been uneven, especially in lower income countries in Asia. Could this also hurt the recovery process? What will happen to these countries if access to vaccines stays low? Yes, and we've all seen that access to vaccines has indeed been uneven, and it remains a challenge for some of our developing members. And continued COVID-19 outbreaks or new outbreaks will remain the biggest risk to the recovery process.
ADB is working on multiple fronts to help overcome this mismatch in vaccine supply and demand by supporting domestic and regional vaccine regulatory systems, as well as securing more supplies from existing manufacturers. ADB is also exploring options to strengthen manufacturing capacity for vaccines within our developing member economies to expand supply now and also to better prepare for future pandemics.
On that note, we thank you very much Pakar Ekonomi ADB yang terlibat dalam rangka Laporan Key Indicators for Asia and the Pacific 2021, Elaine Tan. Elaine adalah juga penasihat pejabat Ketua Pakar Ekonomi dan juga Ketua Pengarah di Bank Pembangunan Asia di Manila. Kita akan berhenti berehat, sekali lagi kembali selepas ini.